All right, I know all you Star Wars fans are fired up about the opening this weekend, but this week on Fyzical TV, we're going to talk about a very serious but very common disease, and that's plantar fasciitis. So I had the chance to sit down with one of the most knowledgeable doctors in the entire country to soak up all of the knowledge. Here I am with Chris Mulvey. All right, let's welcome in Dr. Chris Mulvey, who's going to tell us a little bit about plantar fasciitis. We've heard this over the last couple of months with a guy like Peyton Manning. Right. It's been in the news media, the sports media, and it's not a neck injury that he's had in the past or concussions that's going to end his career. It looks like it's going to be plantar fasciitis. So, Dr. Mulvey, what is plantar fasciitis and what are some of the symptoms?
Sure. So, plantar fasciitis is a condition where the connective tissue on the bottom of the foot that supports the arch becomes inflamed. And the symptoms can be very mild to very debilitating, like Peyton Manning. Classic symptoms are the first few steps. They wake up in the morning, they take a few steps, the pain is very painful. As the tissue warms up, it stretches a little bit, they feel better. Then at the end of the day, they feel bad again.
Tightens back up.
Tightens back up. And then on the more severe cases, as it gets worse, it can be debilitating all day long. So.
Well, what can cause this?
Sure.
How would I know if I had plantar fasciitis, and kind of what are some of the reasons why it happens in the first place?
Right. So there are many different reasons for why plantar fasciitis happens. One would be overuse injuries. Someone who's done an extraordinary amount of running or standing. A factory worker that might be standing for prolonged periods of time without any cushioning. And then certainly trauma, and then lastly, as we get older and our arches starts to collapse, they can put a lot of strain on the plantar fascia that supports the arch. So the plantar fascia is this connective tissue that's on the bottom of the foot that supports the longitudinal arch of the foot. And where it inserts into the bone is often the very first point where people feel pain, but over time, as the disorder progresses, they can feel pain along anywhere in the plantar fascia, and especially when when they're walking and their toes are being pulled up and stretching on that plantar fascia, that connective tissue for people who are inflamed will just scream at them.
It sounds brutally painful. On a scale of 1 to 10, what kind of pain are you having?
Well, again, it varies on the individual. It could be a 1, but it could be as high as a 10, and sometimes surgery is necessary. The most conservative approach is always going to be the best. So I like to talk about treatment from a physical therapy perspective, and certainly surgery last resort. But I always think about the 3 S's. The first S is early in the disease process, stretching. So stretching the calf, a tight gastroc could exacerbate the symptoms. And then specifically stretching the plantar fascia. And so we'll show you some stretches for that today. And then the second S is strengthening. And strengthening both the muscles that support the foot, what we call the intrinsic muscles that support the arch, and then the larger muscles that support and control the motion of the arch as a person walks. Muscles like the posterior tibialis muscle. And then the final S is support. And so when you're going through acute symptoms, and really if you're someone who is prone to plantar fasciitis, you should never walk around barefoot. And so support is twofold. It's support by making sure that you're always wearing a good supportive shoe, and then secondly, using an orthotic to help control the motion of the foot. Put your heel down, and you should feel a stretch right here in the calf. Can you feel that stretch?
Yeah.
You're going to hold that stretch for 15 seconds, and we're going to repeat it 5 times on each leg. Okay, so the next stretch is a specific stretch to stretch out the plantar fascia. You're going to pull your toes up towards you and grab the big toe, and that will put a stretch here on the longitudinal arch. You feel that there? Mm-hmm. Okay, so that actually stretches out the connective tissue. Again, we're going to hold this stretch for 15 seconds, and we'll repeat it 5 times. Now, I recommend you do this when you first wake up, before you start taking your first few steps, or if you've been sitting for a long period of time. And then you're going to scoop the foot back, picking up the arch. So you can use a tennis ball, a stress ball, whatever type of ball you have. And what she's going to do is she's going to come up onto her toes, and she's going to pinch her heel bones together. And so you should see the ball squeeze as she comes up. And so that action of that inversion of the calcaneus is the action of that muscle. So it works that muscle. And then come back down nice and slow. And let's go ahead and do 15 times. We'll do 2 sets of 15.
A big thanks to Dr. Chris Mulvey. I'm Andy Burrell, wishing all of you out there a happy holiday season. May the force be with you.